Just over 3 years ago, the deadliest U.S. wildfires in more than a century devastated the Hawaiian island of Maui. New research suggests the toll of the disaster may be far greater than the lives lost and property burned. Stephanie Tsai reports on a landmark study aiming to track how the wildfires have continued to affect survivors' health long after the flames are gone.
4 days a week, this Lahaina food bank opens its doors to survivors of the Maui wildfires.
Houses in front of us are burning already.
For many, like Mario Acosta, the memories of August 7th, 2023 are still fresh.
Yeah. Can I take a ride from you? I'm sorry, take a ride. Thank you.
A video taken by a stranded stranger he and his wife picked up as they were trying to escape the inferno captured that harrowing day.
When we saw the fire beside us, where we were waiting for the traffic to move on, my wife wants to jump to the ocean. No, I told my wife no. And then the traffic suddenly moved, and then we were able to get away a little bit from the burning buildings beside us.
The Acostas have lived in Lahaina for over a decade, working in hotels. The home they were renting for about $1,000 a month burned down, and they can now only afford a single room without a kitchen.
What have been your biggest struggles since the fire?
All the expenses and things like that, because it went up, all the prices went up too.
How are you doing, like, with your mental health at this point?
It's really hard because it's really was terrifying.
The memories of the ferocious wildfire are still raw for so many survivors, and many are still struggling with things that were hard before the wildfires, namely the cost of living on this beautiful island, which has only escalated in the last 3 years.
People in the lower income brackets, who are often the people who were workers in Lahaina, serving tourists, are definitely the ones who we are seeing right now and are the most affected.
The University of Hawaii's Ruben Juarez and Alika Mauna Kea are conducting a study on the lasting impact of the disaster on survivors' physical and mental health. The Wildfire Exposure Study, known as Maui West, is one of the biggest and most diverse studies of its kind in the country's history. It shows recovery has been uneven.
It's housing security, food and income security, social support, and access to care. Those individuals who have these 4 traits are significantly better off than those who don't.
Beginning 6 months after the fires, they started health screenings for more than 2,000 participants, including mental health assessments and lung and cardiovascular tests.
I cough every day, and I'm not a cougher. And it depends on what kind of day it is. If it's windy and dry, I don't even want to be out here, but I am breathing it in.
Initially, more than 40% of survivors, like Maui resident Nancy Garnett, reported experiencing respiratory issues weekly. Now, 3 years after the fires, 1 in 5 adults continue to have below expected lung function. Those participating in the study are also tested for exposure to heavy metals like arsenic and lead, which can be released in urban fires and may pose health risks. It's a concern expressed by many in Lahaina.
It took me about, I would say, maybe 3-4 weeks to go through the rubble.
Native Hawaiian historian Keeaumoku Kapu ran a cultural center which was destroyed in the fires. For weeks, he searched through the site to salvage precious objects and artifacts.
Not knowing at the time that, you get toxins you got to worry about, you get asbestos, you get arsenic, you get all this lead paint and all that. You could actually smell the stench in the air.
State health officials say the burn zone has been safe for residents since the fire's debris and ash were removed in September 2024.
It was a really difficult night. We cried and just watched the town burn from the beach.
The study has also highlighted the fire's mental health toll on victims, like Krista Woodward, an artist based in Lahaina. Her home of 26 years burned down with the town. The studio where she worked on her glass art was also reduced to rubble.
It's definitely hit a nerve to look there every time I come.
And 3 years later, she's struggling to rebuild. Her new house was less than halfway done when she says a contractor ran away with her money.
I was experiencing this heaviness, like I was moving underwater. I was easily overwhelmed, and my focus, it wasn't like it was before.
Woodward was diagnosed with PTSD, which puts her among the 1 in 5 survivors experiencing symptoms of the disorder, according to the study.
We're still not in a recovery stage. We're still in a crisis stage.
Christopher Knightsbridge is the study team's mental health lead and treats survivors. He found that levels of anxiety and depression are worse for those still struggling to meet their basic needs.
Even now in therapy, a lot of the times, the stuff we're working on isn't their underlying traumas from that horrible day. It's just like, how am I going to feed my family?
Those immediate needs have spurred the Maui West study to go beyond data collection and connect the community with care.
We not only measure, we intervene. Just to give you a very simple statistic, about 40% of individuals that we recruited into the study didn't have health insurance when they came in. 1 year later, we're able to link them to different charitable insurance programs, including Kaiser Permanente, and we're able to cut the uninsured rate by half.
Still, access to medical care remains a hurdle for Lahaina's health recovery. The fires destroyed medical facilities and led to physician flight. Today, Maui County needs 41% more physicians in order to meet its residents' needs.
I'm doing great.
After signing up for the study, Krista Woodward was eventually able to get a weekly appointment with Christopher Knightsbridge. She says the sessions have been a lifeline.
It brought me so much peace to know that I was experiencing, common PTSD as the result of a horrible disaster. And it was normal and it was treatable, and over time I would heal.
Back at the food pantry for Lahaina fire survivors, this assistance is another kind of lifeline for Mario Acosta.
It really means a lot for us, this kind of resources.
But it can't address all his needs. He's still triggered during wildfire season.
Even only smell few smoke, it's really scary, especially on our experience when we were almost get burned alive.
He thinks about the neighbors that didn't make it out alive.
3 of them got burned in the fire. The one beside us got burned in the fire. They're gone. They're gone.
More than 100 people perished in the fires. The losses were staggering. And so many of the Lahaina fire victims continue to live with the harm suffered that day. For the PBS News Hour, I'm Stephanie Tsai in Lahaina, Hawaii.